You wake up feeling a little tired, maybe a slight headache, a low fever. You think it's probably just a cold, maybe the flu. So you do what most people do. You take some ibuprofen, drink a glass of water, and lie down. 3 days later, you can't breathe. And by day 5, you are in the ICU fighting for your life. I have watched this happen, and I need you to understand the disease I'm talking about today kills up to 60% of the people it infects. It has no cure. And most people have absolutely no idea they were ever exposed to it. It is called Hantavirus Pulmonary Syndrome. And if you spend any time outdoors, live near wooded areas, have a cabin, a garage, a barn, or even an old shed in your backyard, this video could save your life. Stay with me. Every single word of what I'm about to tell you matters. Good day, everyone. I'm Dr. William Lee, and welcome back to Longevity Lane, the channel where we talk about the health truths that most people discover only when it is already too late. Now, I want you to pause for a moment and think. When was the last time your doctor sat you down and talked to you seriously about hantavirus? I'm willing to bet the answer is never, and that is a problem, because this is not some rare disease locked away in a distant jungle. This virus is right here in North America, in South America, in rural communities, in hiking trails, in old storage units, and it is more dangerous than most people will ever imagine. In my 40 plus years of practicing medicine, working in emergency rooms, clinics, and preventive health settings, I have seen patients come in with what looked like an ordinary respiratory illness. And within days, the lungs fill with fluid so rapidly that even our most aggressive interventions are sometimes not enough. It is devastating to witness. Even more devastating when I realized this could have been prevented. So today, I want to break this down for you clearly, completely, and honestly. What is Hantavirus Pulmonary Syndrome? Where does it come from? What does it feel like when it's happening inside your body? Who is most at risk? And most importantly, what can you do right now to protect yourself and the people you love? Let's get into it. But out of section 1, what is hantavirus? Let me start at the very beginning, because I believe that when you truly understand what something is, you respect it and you take it seriously. Hantavirus is a family of viruses. They have been around for a very long time, but the specific strain that causes Hantavirus Pulmonary Syndrome, which we call HPS, is primarily the Sin Nombre virus, first identified in 1993 in the Four Corners region of the United States, which is where New Mexico, Colorado, Arizona, and Utah meet. Now, here's the part that I want you to really absorb. This virus does not come from another sick person. It does not spread through coughing, sneezing, or handshakes the way influenza does. It comes from rodents, specifically from deer mice, and in South America from other rodent species. These small, seemingly harmless creatures carry the virus in their saliva, their urine, and their droppings, without ever getting sick themselves. That is what makes this so dangerous and so deceptive. The mouse looks perfectly healthy. There is no sign that anything is wrong, and yet the virus it carries, when it gets into your lungs, can be absolutely lethal. So how does it get from the mouse to you? Primarily through inhalation. When infected rodent droppings, urine, or nesting material are disturbed, when you sweep a dusty old shed, open a cabin that's been closed all winter, or dig around in a storage area, tiny particles become airborne. You breathe them in, and the virus enters your respiratory system. Sometimes people are infected by touching contaminated surfaces and then touching their nose or mouth. In rare cases, in South America, through a rodent bite, but the most common route and the most dangerous is that invisible breath of contaminated dust. Most people have absolutely no idea they were ever exposed. Now, section 2. The 5 critical things you need to know about HPS. Now, I want to walk you through 5 critical things about Hantavirus Pulmonary Syndrome. I'm not going to rush through these. Each one is important. Each one could be the difference between life and death. Your life, or the life of someone you love. Critical thing number 1. The symptoms lie to you. This is the single most dangerous characteristic of this disease, and I've seen this mistake destroy lives. Hantavirus Pulmonary Syndrome does not start looking like a life-threatening illness. It starts looking like the flu, and in that lies its greatest deception. In the early phase, typically the first 1 to 5 days after exposure, you will feel general fatigue, fever, muscle aches, particularly in the large muscles of the thighs, back, and sometimes the shoulders. You may have a headache. Some patients experience chills, nausea, vomiting, or diarrhea. There is usually no cough at this stage, no obvious respiratory symptoms. And so what do people do? They do exactly what you or I would do. They rest, they take over-the-counter medication, They tell themselves it'll pass. They wait. I had a patient, I'll call him Frank, 62 years old, retired, absolutely fit man. He spent a weekend cleaning out an old hunting cabin in the rural countryside, swept the floors, cleared out some old boxes, found evidence of mice, but he thought nothing of it. By Monday, he had what felt like a bad flu. By Wednesday, he was struggling to breathe. By Thursday, he was in my emergency department, and his oxygen levels were dropping so fast we could barely keep up with it. That progression from ordinary symptoms to catastrophic respiratory failure can happen in 24 to 48 hours. Here is what I need you to understand. If you have been around rodents, rodent droppings, or dusty enclosed spaces, and you develop flu-like symptoms, you must tell your doctor that immediately. Do not assume it is just a cold. That information changes everything. Critical thing number 2, the cardiopulmonary phase. When the body starts to drown after that initial flu-like phase comes what we call the cardiopulmonary phase. And this is where hantavirus stops being mistaken for anything ordinary. What happens is this. The virus attacks the cells lining the small blood vessels inside the lungs. It causes them to become extremely permeable, like a bag full of holes. Fluid begins leaking from those blood vessels into the air sacs of the lungs. The very spaces where oxygen should be entering your blood become flooded. You start to feel intensely short of breath. Breathing becomes rapid and labored. Your blood pressure may drop. Your heart has to work harder and harder to compensate. In severe cases, the heart itself weakens, a condition we call cardiogenic shock. This can progress to complete respiratory failure within hours. This is what makes HPS so lethal. It is not a slow decline, it is a cliff. You fall off it quickly, and catching you requires intensive care, mechanical ventilation, careful fluid management, hemodynamic support. The mortality rate for Hantavirus Pulmonary Syndrome ranges from 38 to 60%. Let me say that again clearly. Up to 60% of people who develop full HPS do not survive it. Even with the best modern intensive care medicine available, there is no specific antiviral treatment approved for this disease. There is no vaccine. All we can do is support the body and pray that it finds its way through. That is why prevention, absolute meticulous prevention, is not optional. It is everything. Critical thing number 3. Wuchio is most at risk and most likely to inaugurate. Most people don't realize this until it's too late, that their own lifestyle and habits may be putting them directly in the path of this virus. People at highest risk are those who work or spend time in enclosed rural spaces where rodents may nest. That includes farmers and agricultural workers. It includes people who open up seasonal cabins or vacation homes after months of being closed. It includes hikers and campers who sleep in old shelters or disturb leaf litter and soil. It includes people who work in old barns, storage facilities, grain silos, or tool sheds. It includes construction and utility workers in rural areas. And critically, it includes ordinary homeowners who are cleaning out a basement, attic, or garage that may have been accessed by mice. If you are over 60, this is critical. Not because older adults are necessarily more likely to be exposed, but because as we age, our respiratory reserves diminish. Our lungs are not as resilient as they were at 30. Our immune systems are less aggressive. If hantavirus does take hold in an older body, the margin for recovery is narrower. And here's the part I find most heartbreaking in my practice. The people who get infected are often the most hardworking, most practical, most hands-on individuals. The grandfather cleaning out the old workshop to build something for his grandchildren. The retired couple finally getting around to clearing the old farm shed. They had no idea they were walking into something dangerous. You can love the outdoors. You can love working with your hands. You absolutely should. But you must do it informed, and you must do it protected. Critical thing number 4. Where this virus is, it may be closer than. You think I want to address something I hear far too often. People say, oh, hantavirus is a southwestern U.S. problem. It doesn't affect us here. That is incorrect, and that false sense of security has cost people their lives. In North America, HPS cases have been reported from Canada all the way down through the United States and into South America. The deer mouse, the primary carrier of the Sin Nombre virus, has an enormous geographic range covering most of North America. Cases have been documented in nearly every U.S. state. In South America, different rodent species carry different but equally dangerous strains of hantavirus, and the incidence in countries like Argentina, Chile, Brazil, and Paraguay has been significant. The virus is most prevalent in rural and semi-rural environments, but it is not limited to remote wilderness. It can be found in suburban outbuildings, outbuildings, in homes that border wooded or agricultural land, and anywhere that rodents find shelter. Rodents are opportunistic. They follow food sources and shelter. If your property has gaps in the foundation, openings in the walls, or access points around pipes, mice can enter. And if mice can enter, so potentially can the virus they carry. The environmental conditions that increase risk include drought, because reduced food and water supplies in nature push rodents closer to human dwellings. Population booms in rodent numbers, which can occur after a particularly productive season for their food sources, also correlate with increased human cases. This is not a distant, exotic threat. In many parts of the world, this is a backyard threat. Critical thing number 5. Prevention, what you must do and what you must never do. This is where I want you to pay the closest attention, because this section is the one that will actually protect you. There are right ways and catastrophically wrong ways to handle areas with potential rodent activity. Let me start with what you must never do, because I have seen this trigger illness directly. Never, and I cannot emphasize this enough, never sweep or vacuum an area where you suspect rodent droppings or nesting material without first properly disinfecting and ventilating the space. Dry sweeping or vacuuming disturbs the dried particles and sends them directly into the air you are breathing. People do this every single day, completely unaware of the risk they are taking. Never work in a confined space with potential rodent contamination without respiratory protection. A standard surgical mask is not sufficient. You need at minimum an N95 respirator, properly fitted, to filter out the microscopic particles that carry the virus. Never ignore signs of rodent activity in enclosed spaces you are about to work in. Mouse droppings, gnawed materials, nesting debris, urine stains, or the smell of rodents are warning signs. Stop. Protect yourself. Then clean. Now here is what you should do instead. If you discover a space with evidence of rodents, before you do anything else, open the windows and doors and ventilate the space for at least 30 minutes. Fresh air circulation is critical. Then put on your protective equipment, an N95 respirator, rubber or plastic gloves. If possible, a disposable protective suit or work clothes you will wash immediately afterward. Prepare a disinfectant solution. A mixture of 1.5 cups of household bleach per gallon of water works well, or a commercial disinfectant effective against viruses. Spray the contaminated areas thoroughly and allow the solution to soak for at least 5 minutes before you touch anything. Then use paper towels or damp cloths, not a dry brush, to carefully wipe up the materials. Place everything in a sealed plastic bag and dispose of it properly. After the area is cleaned and disinfected, you can then mop or wipe down surfaces. Wash your hands thoroughly. Wash your work clothes separately from your regular laundry. For long-term prevention, focus on rodent-proofing your property. Seal any gaps or holes in your home structure that are 1/4 inch in size or larger. That is all a mouse needs to squeeze through. Store food, including pet food, in sealed, hard containers. Keep wood piles and brush away from the house. Set traps in areas where you see rodent activity. Prevention is not complicated, but it requires discipline and awareness. And now that you have the awareness, the discipline is up to you. I want to take a moment and step away from the medical information and speak to you person to person. Most of you watching this video are watching because you care. You care about your health, or you care about the health of someone you love. Maybe a parent, a spouse, a sibling. Maybe you're watching because you've spent a lifetime working hard, and now, finally, you want to protect what you have left to enjoy. I understand that, and I respect it deeply. Here's what I've learned in over 40 years of medicine. The patients I have seen suffer the most, the ones whose stories stay with me at night, are not usually the ones who took unnecessary risks. They are the ordinary, hardworking people who simply did not know, who had never been told, who went about their day doing completely normal things, cleaning a shed, camping with their grandchildren, opening up the family lake house, and had no idea that an invisible danger was present. Knowledge is protection. The few minutes you spend in this video today are genuine, measurable protection for your health and for your life. And if you are a senior watching this, if you are in your 60s, 70s, or beyond, please understand that your lungs, your heart, and your immune system have worked extraordinarily hard your whole life. They deserve to be defended. You deserve to live your remaining years with vitality, independence, and the joy of being present for the people who need you. Do not let something preventable take that away. Now, if this video has opened your eyes today, if it has given you information that you know someone you care about needs to hear, Please do not keep it to yourself. Share this video. Send it to a family member. Post it in a group. That one action could genuinely save someone's life. And if you have not yet subscribed to Longevity Lane, I want to ask you to do that right now. Hit that subscribe button and the bell notification, because every week we bring you the health truths that most people only discover when it is already too late. Your health depends on this information, and this information is right here, every week, waiting for you. Leave me a comment below. Tell me, did you know about hantavirus before today? Have you ever worked in or around spaces where rodents could be present? I read your comments personally, and your stories and questions shape the content we create for you. And if you found this video valuable, a like takes 2 seconds, and it helps us reach the people who need this information most. Your health is not an accident. It is the result of the choices you make and the knowledge you carry. You've made a good choice today by watching this. Hantavirus Pulmonary Syndrome is rare, but rare does not mean impossible. And for the person it strikes, and for the family watching helplessly from the waiting room, rare means nothing at all. The mouse in your shed does not know it is carrying something deadly. It is simply surviving. But you have something the mouse does not. You have knowledge. Use it. I'm Dr. William Lee. Take care of yourselves. Take care of each other. And I will see you in the next one. If you care about your health, want to understand what's silently harming your body, and are ready to learn the truth about living a longer, stronger, and healthier life, subscribe to Longevity Lane with Dr. William Lee. Here, we reveal the health truths most people discover only when it's already too late.